This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Long-Term Effects of Head Trauma and Concussions on Wednesday, October 9th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing.
Hi, everybody. Welcome to Ageless Health Livestream. And this is me, Dr. Tom, and I've got an interesting program for you today, one that it kind of affects way too many people, except that we put up with it. And we take drugs for it, and we go to rehab with it. It never completely resolves itself. So we end up giving up what? We get giving up all the things we like. Everything from our pickleball games in today's world to other handball games to golf, lifting things up. We got to get people to help us with our coat on because we can't bring our shoulders back. All of those crazy things that we think should be automatic, and now we can't do them. And people say, well, what do you expect for your age? Well, here's one of those elements that I want you to understand, that if you get it early enough, you can fix it. So what are we talking about? We're talking about your shoulders and all the problems that can come about from ignoring little injuries and maladaptations and not getting good range of motion, but also more importantly, not taking care of your spine. And I'm going to kind of put the links together. We're going to explore them as time goes on. So here's probably the thing that you need to look at, right? So if you're looking at me right now, I'm sitting here and I can lift my arms up, I can move my hands, I can push away from me, I can lift them up further and so forth. But what happens if I can only go to this level and I can't get them above my head? That tells you there's something wrong. And so we go to the doc, good guys as they might be, and they look at the symptom process. Okay, let's do what? Where does it hurt? So you show where it hurts, and well, let's try this. After they said, how long has it been going on there? And they'll inject it with a steroid. They'll give you an anti-inflammatory, and then after you've done it for a short period of time, they're going to do what? They're going to send you for rehab. Now we're going to talk about that for a second. The shoulder problems are so important to be managed properly that if you don't, you give up your life. Ladies, think about what you do, right? Besides putting your shirts on and so forth, but you got to put your bra on first, right? Most of you are going to do that on a day-to-day basis. So you put your arms behind you and you hook up the tab. If you can't get them behind, what are you doing? You're bringing it around, and then you're going to hook it to the front. Then you got to bring it back like this. That's an adaptation of something that you should be able to do easily. Guys, how about if you can't put on your tie because your shoulders, your arms won't come up so you can hook it up the way it's supposed to, or button the collar on your shirt? That can be a neck and shoulder problem. See, I just introduced the other piece. Shoulders are controlled by the nerves that come from the lower part of the neck and the upper part of the back. Now, if those are irritated, the muscles that are associated with them will not fire properly. When we look at the chest muscles, we look at the shoulder muscles. So they're called different things. The muscle that comes up like this and attaches into the shoulder is called the pectoralis sternal division, breastbone division. There's another one here. It's called the pectoralis clavicle division. You have this clavicle, this bone, this collarbone that sits right here, and then it comes together with part of your shoulder blade, and that's called the AC joint, the acromioclavicular joint. Now, I busted up the one on my left side years ago when I was foolish enough to not take cautions when I was riding motorcycles, and I dumped the bike. I came over, I tried to lay the bike down and separated my AC joint. Today, and this is, oh my gosh, probably 40 some years later, I still have some issues with that shoulder. And because I didn't know then what I know today, and so forth and so on. Having said that, look, let's get into this, because your shoulders, if you can't use your arms and they're just hanging there, and things are not good. They're not adapted the way they're supposed to be. So let's talk about that muscle. Remember, I've talked about organ muscle patterns over time. So what happens if you don't have the power to push forward? You can't do this. What muscle does that? Those are several. The triceps back here, the pectoralis sternal muscle here, and then a muscle coming off your arm called the anconeus. So when you throw a punch like this, those three muscles are firing. But what happens if the nerves go to those muscles aren't working? More importantly, what happens if the organ systems that are connected to those muscles aren't working? Remember, organ muscle? So the pectoralis muscle sternal division is what? That's your liver function. Yeah, liver. How about the triceps? The triceps has to do with blood sugar transport and pancreatic function. The biceps, which comes up and attaches the shoulder, has to do with your stomach. So if your gastrointestinal system is not working, if you're overpolluted, if your blood sugars are tanked and not balanced properly, you could end up with what? Shoulder pain. And we don't think about that in a traditional setting when we want to try to fix them. So we just say, well, it is what it is. No, you have to look at multidimensionally. You have to look at the neurology, which we just talked about, that comes from the lower part of your neck. We have to look at the biochemistry, which we're talking about, the things that may have polluted these things are not balanced properly, and the stress pattern. Remember, I've said repeatedly, those of you who listen ongoingly, that the liver, so subsequently it'll affect the pectoralis muscle here, has an emotion as well. What's that emotion? Anger. There's a lot of people out there that have been really, really angry for a long period of time, and for all kinds of things. They're hair triggered. Do you think that's not going to affect their neck and shoulders? I promise you it is, because we see it all the time. We're going to get in just a little bit into this process today, but I want you to understand it's amazing what really causes these things to happen. If you walk somebody on a treadmill, put them on a treadmill and you look at them, you're going to see the body move in certain portions. There should be a nice, easy rotation. And sometimes it's not. You see this shoulder going, this one's stuck. This one's going, this one's stuck. Or opposite, this one's going, this one's stuck. When that happens, it tells you the mechanics of gait are not moving the way they're supposed to. So it could be the right shoulder is being affected by the left hip. That is your gait pattern. This wrist is affected by your left ankle. That's the gait mechanism that's associated with it. So when somebody comes in and they have problems, we're going to be looking at the different pieces of relationships that are associated with that mechanism that you're saying ouch to, or you can't do something about. We're going to have a really, really interesting night here at the Roselle Center coming up very, very rapidly. And I want to invite you. It's going to be on the 19th of March. Dr. Harlan Browning, the professor, and I are going to co-teach together. And, both of us have a lot of background and experience in pain. I had the pleasure of treating a whole bunch of the guys, back in the day, the old Washington, dare I say it, Redskins, and I was the doc for the Mystics. So those are all shoulder movements, right? There are all kinds of problems that are associated with that. And I'd see these players, these magnificent athletes come in and they'd be all beat up, but they were strong enough that they would compensate. So if somebody went like this and it hurt, all they did was slightly change the vector of the shoulder until they couldn't do that. And they would put up with it until they couldn't anymore. So when we go through this, I want to show you that you may be doing things that you think are helping, but make things worse. If you have an inflamed shoulder and you decide to take a couple of aspirin, are you helping yourself? Yeah, if it's only once, Advil once, maybe drop it down, you throw a bag of ice on it, you're good to go. And then you have full functional motion if it's treated right, but you have to test every one of the muscles. If you test the muscles properly, and you find out which one may or may not be facilitated working properly, and you fix that, now you're good to go. But what happens if you have to keep taking that aspirin? What happens if you continue to blunt the symptom? Well, that aspirin competes with the healing chemistry called sulfate ion or sulfite ion, because that's what the cartilage needs. It blunts it. It gets into the receptor before that, and it doesn't allow the sulfite to get in there. So now you don't feel the inflammation or pain, but you begin to cause that joint to quietly, subtly become more impaired and degenerative and deteriorate over a period of time. It's important. So as we go through the process, we have to make sure that you understand what it is that we're doing. And by the way, I may have made a mistake on telling you who's going to be with me on the 19th. It'll be me, obviously, but I think it might be Dr. Jerry Cowart, which is even better because this is a not young doctor. He's been with me now quite a while, but he gets it. He understands it. He's active. He has capacity. And so forth. And by the way, he and I co-treat together, so you're going to get the best of both worlds. If you show up, that'll be on the 19th. And make sure that you join us at the Roselle Center. But you got to register. You got to go to rosellecare.com or drtomroselle.com and hit the button, register now. And if you can't make it, by the way, things come up, please call us, 703-698-7117, and make sure that you register for the class and cancel it if you're not going to make it happen. So we're going to have a good time on that night. Here's the thing. I want to show you a couple of things what happens, right? So you go to the doc and the doctor says, you got this problem. You got a bad shoulder. You have a bursitis. You have a tendonitis. You have an inflammatory something. What's a bursitis? A bursitis is when you try to lift it and it causes pain, or I lift your arm without your involvement and it's painful. That's a bursitis. What's a tendonitis? A tendonitis is when you lift your arm up, like my mouse, you lift it up and it causes pain. But if I lift it up, there's no pain. That's how you distinguish a bursitis from a tendonitis. Now, you treat them differently. You have to make sure that you know which one is which. When you look at the muscles, the biceps, and through here, there's two heads. There's two heads. One that comes right up in the top. It's called the long head of the biceps, and one is a short head. And you have to test them properly. It's not just by bending your arm and doing this. You got to put the arm out like this, and you test it this way as well. You take it out to the side. You use different vectors and try to find the position that it's there. The front muscle here, the anterior deltoid, is tested with the arm in this position. Not just a pull down test. It's like this. Now, the middle deltoid is up like this, and it's like that. There's multiple muscles. You have the serratus andicus, you have pectoralis sternal, pectoralis clavicular, subclavius. You have muscles that could be acting up. And I said in the program earlier on WMAL 105.9 is that you could have shoulder pain that's a result of a heart problem. Did you hear me? You could have shoulder pain that is a result of a heart problem slowly over a period of time. Now, that shoulder pain, the distinguishing characteristics are simply this. It doesn't go away. You can't get a comfortable position. It's just a general ache that's there. It could be low level. But if I look at that and I look at somebody's tongue and the tip of their tongue is red, if I look at their face and it's ruddy, it's a redness there, or they look like they're, the tone of their voice is not what it should be. Those combinations start finger pointing, and I'm not going to send you to an orthopedist. I'm not going to send you to a rehab guy. I'm going to send you to a cardiologist and make sure that we rule that out and make sure there's not an issue that might be associated with something that's lurking. And all of a sudden, because of my neglect, you're not here anymore. We have to make sure that we find specifically what's going on and how to demonstrate. Now, I said earlier on the program that if you go to rehab, your doctor gives you a steroid, injects your shoulder, pain goes down, but it hasn't fixed anything. So they send you to rehab and they're going to put you through, different exercises. But I lovingly say that physical therapeutics, most of them have religion of 10. That means you're going to do 10 something, 10 of this, 10 of this, 10 of this. But guess what happens? You may only be able to do it twice or 3 times before you're causing more problems. So when we test muscle function, we find out how many repetitions your muscles can do before they break. So for example, if I put your arm out like this and I'll say, resist my pressure, 1, 2, and then the third one, it weakens, you can only do that exercise twice. Anything more than that causes damage. Now, you do twice, you let it relax. You do twice, you let it relax. Better yet, you're putting ice over it at home. And then pretty soon, the next time I test you, 1, 2, 3, 4. Now you can do 4 before it breaks or 3 before it breaks. So we increase the increment. Now, truly, the muscle is getting stronger. And that's what you have to understand. If you don't do it in a judicious way, in a way that is a very specific and reparative, restorative, you're going to hurt it, you're going to break it down. So join us on the 19th, and I promise you, we're going to go through all this with you. We're going to show you what's going on. But here's the deal. You've been putting up with a sore neck for a period of time, and it kind of hurts right in through here, and you're always stretching it. You're always trying to figure it out. But now what happens, you notice that you're not able to move your arm the way you're supposed to. So you think, you strained your arm someplace. Without thinking, the connection between the neurology here and the functional capacity here. So that's what we're going to try to do. We're going to try to put those together for you and define it so you really get to understand what's causing it. If you don't fix the why, you can't fix it. And by the way, whether it's the shoulder, whether it's your hip, whether it's your knee, whether it's your ankle, all of those things have the same. They all have muscle patterns. They're all used in functional capacity and motion and gait. But we're going to ask the question is this. Let me ask you this. When was the very first time you ever may have had a problem with your shoulder or your neck? When was the very first time? What do you mean it's the very first time? Yeah, when's the first time? Did you ever hurt it? Yeah, well, I played sports in school. Yeah, I was getting banged around. Okay, good. Let's go back to that time. That's where you start. Or something that happened when you were a kid. You got in a little tussle and a tumble with somebody. Or, you did something that you shouldn't have done, and because you didn't have the mechanical strength to make it happen. That's what you have to look at. If you get the right view on it and you fix it the way it should be fixed, you decrease the inflammatory action, you reconnect the neurological platform, you do those things the way you're supposed to do them, and you put that gait pattern back into its normal, proper position. How many of you, when you walk, you get a little bit of motion, kind of a pivotal effect in your system? Or you walk like, just straight ahead. There's no motion, there's no movement, there's nothing. You walk like a stick. Oh, you've heard that term before, right? On the 19th, join us. And I promise, make sure you reserve a seat, because once they're filled up, they're filled up. And please, please, please do me a favor. If you know you can't make it and you've reserved your seat, please call us at least a day before and say, hey, I can't make it. We'd love to be prepared for you. We want to make sure that we entertain you. Entertain you meaning educate you the way you're supposed to, receive the data that you need to receive, and give your life a little bit of a boost. Join us. I hope this helps. We're going to get into the puzzle a little bit deeper as we go through. We'll talk about all the things that can cause the shoulder. Remember I said organ muscle pathways? We're going to talk about your lungs as well. Did you know your lungs have muscles that work with them? And if the lungs aren't working the way they're supposed to, the shoulder's not going to work the way it's supposed to. But join us on the 19th. I'll see you next week with a brand new program, and we'll kind of tie the dots together. And remember, I'm here every week for one reason and one reason only. You deserve the data, but more importantly, I love you all. Take care. Have a great Sunday. Bye.
you.